Bismillahirrahmanirrahim. Uh, I welcome you all to this SOGP, SAFOG, and FIGO session. And this one we have designed for, this was a unique topic which is not kind of discussed in majority of the forums, and people don't like to talk about it actually. So we decided to talk about the problems which we face as in respect of violence against healthcare professionals. And these healthcare professionals does not only include the doctors, they include everybody whoever works in the hospital, including the paramedical staff, in the guards, the janitors, social services, the ward boys, and everyone. So we are kind of running slightly late, but it's my honor first to invite the chairperson for this section, who's going to be Professor Farooq Zaman. He's the past president of Dean and consultant working in Humiliative Hospital. He's been associated with SAFOG for the last, from the day it was born, and they did their first conference in Lahore. It was way back in 1996 when it was started. So welcome, sir. And it's very kind of him, he had to rush from that president sessions to be here. So first of all, we're going to play a video from Professor Rohana Hatawatu. He is from Sri Lanka. He is the current president of SAFOG, and he is also the Secretary General of Asian Oceanic Federation of Obstetrics and Gynecology, which is another association in AOFOG now. And he's the immediate past president of Menstrual Disorder Committee of FIGO. So he would, if we were tried, we could not get him online, but I think we have his introductory video of this session. So can we have the video, please? So these online things, they have their own small jittery things, but hopefully we'll resolve them. Yeah. Volume, please.
ऑडियो आपके पास से चलेगी वॉल्यूम खोलें उसको ऑडियो उठाइए भैया इस सिस्टम की ऑडियो उठाएं इस सिस्टम की उठाएं ना ऑडियो
Did we rectify this issue? I think I also would like to invite Professor Dr. Lubna to be on the stage as well. Professor Farooq. He's also a chief activist, and the first her introduction was done by Dr. Professor Rubina Suhail.
Bismillahirrahmanirrahim. Welcome to the session, everyone. I would like to invite Professor Lubna Beg. She is the first PhD in medical education, and we are very proud of her achievements in working for the prevention of violence in healthcare workers. She has a large experience, and she was sharing with us the kind of work that she has done about it. She is currently the Pro Vice Chancellor, Jinnah Sindh Medical University, and presently the chairperson of AIPH. She trained as a medical doctor with specialization in public health and medical education. Welcome, Professor Lubna, and I'm sure you will have much more to contribute in terms of the work that you have done. Thank you very much. And if Dr. Rohana's talk is ready, can we start that?
I welcome everyone to this SAFOG session. Firstly, I like to thank Dr. Asia Korejo, the President of Society of ONG of Pakistan, and Professor Halima Yasmin, Secretary General of the Society, and all the office bearers for giving SAFOG an opportunity to have a session in this wonderful Congress. I also like to thank officers for approving this program. And then, good afternoon, everybody. I welcome everyone to this SAFOG session. Firstly, I would like to thank Dr. Rasia Korejo, the President of Society of ONG of Pakistan, and Professor Halima Yasmin, Secretary General of the Society, and all the office bearers for giving SAFOG an opportunity to have a session in this wonderful Congress. I also like to thank Professor Rubina Sohel, who is the chair in the PIGO Committee on Women Facing Crisis, for joining with SAFOG in conducting this session. And I thank all the PIGO officers for approving this program. And then Professor Rubina Sohel, and she is the past president of SAFOG and a very active member in SAFOG activities, and Professor Yusuf Latif, who is the Secretary General, really organized and planned this program and did all the organizations. So I thank them for all their work. Firstly, I would like to make a brief introduction to SAFOG, but I know in Pakistan I don't have to do it because it is in Pakistan that the real foundation, the solid foundation, was laid to SAFOG 25 years ago. The first meeting to form SAFOG was held in Sri Lanka, but the first. Good afternoon, everybody. I welcome everyone to this SAFOG session. Firstly, I would like to thank Dr. Rasia Korejo, the President of Society of ONG of Pakistan, and Professor Halima Yasmin, Secretary General of the Society, and all the office bearers for giving SAFOG an opportunity to have a session in this wonderful Congress. I also like to thank Professor Rubina Sohel, who is the chair in the PIGO Committee on Women Facing Crisis, for joining with SAFOG in conducting this session. And I thank all the PIGO officers for approving this program. And then Professor Rubina Sohel, and she is the past president of SAFOG and a very active member in SAFOG activities, and Professor Yusuf Latif, who is the Secretary General, really organized and planned this program and did all the organizations. So I thank them for all their work. Firstly, I would like to make a brief introduction to SAFOG, but I know in Pakistan I don't have to do it because it is in Pakistan that the real foundation, the solid foundation, was laid to SAFOG 25 years ago. The first meeting to form SAFOG was held in Sri Lanka, but the first. Good afternoon, everybody. I welcome everyone to this SAFOG session. Firstly,
Thank you, Dr. Rohana. And we're very unfortunate we couldn't take you live, but still we were lucky enough to have your message over here. मैं जितनी भी पहले कॉन्फ्रेंसेस पे गया जब भी बात हुई तो इट वाज ऑलवेज अगेंस्ट वायलेंस अगेंस्ट वुमेन एंड आई ऑलवेज थॉट कि क्या ये वायलेंस सिर्फ फीमेल के पीछे भी होता है कि किसी और के लिए भी होता है सो वन ऑफ द रीजंस वी डिसाइडेड ऑन दिस एंड कि हम इसके बारे में बात करें ताकि थोड़ी सी अवेयरनेस आए ताकि लोगों को पता चले वेयर वी स्टैंड तो सो फर्स्ट स्पीकर वी हैव इज प्रोफेसर रुबीना सुहेल she has, I'm sorry, she's the consultant ops and gynae in Hamilati Hospital. She's the pioneer of kangaroo mother care in Pakistan, and she's the chair of FIGO Committee on Women Facing Crisis. She's a past president of the SAFOG, and she has widely published, and recently she has published a book on LHVs and healthcare as well. So she's going to talk about the burden of disease of this problem, and I'll, without further ado, invite Professor Rubina Suhail to be on the stage. Madam.
Bismillah Rahman Rahim, and thank you very much, Professor Yusuf Latif, for this great introduction. Without further ado, I would like to appreciate the young crowd who's sitting over here, because I was telling them that the elders of the profession have already been through tough times, and it is they who have to learn how to handle these incidents of violence and how to prevent situations of violence. Can I have my first slide, please? The topic that has been allocated to me today is the burden of violence against the healthcare providers and its implications. So I will stick to that only. I just want to start with this very small, real live video of Services Hospital Lahore. Focus on the doctor. How painful is this to see one of your colleagues being slapped by the public for nothing that he did not do? So it's a very painful situation, and we are all aware of it. Now, the outline of my presentation is going to be what counts as violence. So what is violence actually? What is the extent of the problem? Why does it happen? And what are the implications of violence? Now, when you look at the fact that what counts as violence, it is basically the behavior which involves the use of physical force, which is intended to either hurt you or humiliate you or damage and sometimes even kill somebody. Verbal abuse I have specially mentioned over here because verbal abuse is a very serious form of violence, and this is the kind of situation which actually leads into physical abuse if nothing is done to change the situation. Now, WHO framework guidelines of 2002 say that workplace violence is defined as the situation where staff is ill-treated, intimidated, attacked in conditions which are linked to workplace, including commuting to and from the workplace, involving explicit or implicit challenges to their safety, well-being, and health. So this is how we define violence, but I'm just going to go over to the next slide and share with you what do I feel that what counts as violence. As I said before, physical abuse, verbal abuse, bullying, mobbing. Did you see that small video in which the crowd was gathered around the doctor? The way he went up and slapped the doctor. So there was mobbing, there was bullying, there was verbal abuse, there was psychological violence, assault, and sometimes there is sexual harassment. But it is also very important to see that there are other forms of violence which are existing in the countries of South Asia. And these forms of violence are the use of social media for conducting their activities, cyberbullying, threatening, defamation. There was this very serious case of a gynecologist in Lahore who was defamed by a social media person, and very recently actually PMC, the Pakistan Medical Commission, has given a verdict on that, and the doctor has been absolved of any responsibility. And then the media, the role that can play in the situation of violence. Now, there's a very important fact which has been noted, and that important fact is that how quickly verbal abuse actually converts into a physical assault, and how it is that the other patients and the relatives behave as they did not see anything. So they do nothing to save the doctor from that assault, which means that these silent witnesses are probably partners in crime. So if you look at the extent of the problem and you compare it to the situation, the healthcare workers are at least 4 times higher suspects to violence than any other workforce. So healthcare workers are particularly at risk. And if you look at the healthcare workers and their situations, I will talk about it later, that they are doing long hours, resting little, working hard, and still they are being bullied. So if you look at the problem, because we are talking in the South Asian Federation session, so I'm going to go through the countries of South Asia and look at what is the situation in each of the South Asian countries. So for Pakistan, if you look at it, this was the paper which was published in BMJ Global Health. And this paper actually shows you the reasons for violence. So the maximum reason for violence was when the patient had died. There was violence when the patient was serious. So as soon as the patient becomes serious or dies, relatives feel that it is the responsibility of the doctor to make sure why the patient could not be saved and why is the patient so serious. Now, this is again a publication of BMJ which shows the magnitude and the determinants of violence against healthcare workers in Pakistan. And this is a serious study which was conducted in 4 large cities and 12 districts in 3 provinces of Pakistan. Now, it covers all healthcare cadres, and the study actually shows you that their verbal violence is 33.9%, physical violence about 7%, and 1/3 of the healthcare providers reported violence in the last 6 months. It has been exaggerated because of COVID as well, but despite that, 38% of the healthcare providers said that they had been faced incidents of violence. Now, the reasons, again, as I told you before, were death of the patient, serious problem of a patient, and sometimes the perceived delay in care of the patient. Let's look at India. India says that the workplace violence against doctors in India is a serious problem and it is nothing new. But recently, it has grown into epidemic proportions. Doctors are more worried about their safety than actually the welfare of their patient. Now, that fear is palpable, and it says that 56% of the doctors in India did not get comfortable. They slept for barely less than 7 hours of sleep. 13.7% faced criminal prosecution. 82% of doctors in India feel stressed out in their profession. 46% fear violence. 24% have fear being sued, and 57% have thought of hiring security. उन बेचारों की तनख्वाह कितनी होती है, and despite the limited pay that they are getting, they want to hire security to protect them. And if you look at this, the maximum people actually thought or were stressed out because of the violence against the healthcare workers. Look at Bangladesh. Again, the situation is same. And this actually shows you that the maximum problem was faced by the emergency medical officer, by the intern doctor, and again by the medical officer. So the younger doctors and the doctors which are there for a longer period of time are actually more susceptible to face these incidences of violence. And this was a paper again published in Bangladesh, which shows us the workplace violence, and it said that 86% of male doctors faced violence and 63% of the hospitals were actually government hospitals, which means that as compared to private facilities, the government facilities are experiencing more episodes of violence, and most of the episodes of violence, around 61%, actually happened at night. And the people again thought that the treatment had been delayed, and they thought that there was power practice going on, and that is why they were not given enough attention. Now let's go over to Nepal. And Nepal says that the rude health, fear and violence in Nepal's medical system, again a paper which was published in Kathmandu, and it says that when the patient dies in the hospital owing to the alleged negligence of the doctor or the hospitals, family members and onlookers storm the hospital and attack the medics rather than the law take their own course. So let's look at it. Everywhere the situation is the same. All the countries are going through a similar situation. And if you look at Nepal, the incidence of reported cases of violence from 2007 to 2020 are on the rise, and they are continue to increase and cause problems for the doctors. So the prevalence of workplace violence in Nepal is 63%. It is huge. And now coming to Sri Lanka, Sri Lanka has a little bit of a better situation, but instead of the doctors, nurses are prone to violence over here. Though Sri Lanka has got many laws and sections in place. So Section 345 of the Penal Code of Sri Lanka actually provides protection for such victims and can be invoked in a court of law, which is wonderful. But even in Sri Lanka, the incidence of violence in terms of the nurses has increased, and this is a paper which shows perceived workplace violence by nurses enrolled in BSc nursing program, and that is a reason for concern. Now, having looked at the situation of the countries, I think it is important to see that COVID 19 has actually worsened the situation, and it has played havoc with the whole situation. So, numerous reports are coming in which shows that the incidence of violence against the healthcare providers is on the rise. And somehow the doctors are being blamed for the pandemic, in the sense that people think that the doctors are agents who transfer the disease to the patients when they come to the hospitals. So the doctors are facing a deadly situation, and it is an COVID 19 has proved to be an explosive fuel to the raging fire of violence against the healthcare providers. Now, if you look at the overall situation of the healthcare workers in South Asia, what are we actually going through? If you forget about the violence and you look at the general situation, you will note that most of the healthcare professionals are working between 40 to 60 hours a week, plus 1 or 2 nights per week when they are on call as well. So, what is happening? They are working for long hours, they are suffering from lack of sleep, there is work stress, there is lack of trust by the patients and the families, there is lack of health facilities at the workplace, medicines not available, but the healthcare providers are being blamed instead of the administration of the hospital. There's poor pay structure, there are issues of healthcare providers with their own work life balance, and they are frustrated. So if these healthcare providers face issues of violence, then the situation even becomes worse. Now, the question is, why does this happen? So basically, the reason that it happens is, one of the reasons which I think that it is an all encompassing reason is, number one, the lack of trust on the healthcare facility, on the healthcare system, and the healthcare providers by the patients. And the second is our attitude and the attitude of the public as well. So, just 2 more minutes, Yusuf. So if you look at it from three perspectives, the perspective of the patients are mostly uneducated, lack awareness, lack communication, and do not have enough information. They are unsatisfied. They perceive that there is lack of attention. They are at distress because the patient is serious, and they feel that medical negligence have been committed. Doctors, on the other hand, have problem with their own attitude, problem in communication skills, and overall apathy. The health system does not have a system. They do not have policies in place. There are long waiting lines. There's problem with the communication. Labor room and ICU facilities where these problems are happening, maximum in number, are poor at best. The cost of healthcare is high, which most of the time the patient has to bear, and there is no mechanism of a grievance redressal system. So, under the circumstances, you see that the incidence of abuse continues to pile up in the hospitals. Now, what are the implications for the healthcare providers? The implications for the healthcare providers, they are unhappy, they are under stress, they lose interest in their work, they keep on making mistakes, and they perform poorly at the workplace. So they are under stress, there are psychological repercussions, there is depression, and one of there might be incidents of suicide, which needs to be looked into very carefully. So, because the other speakers are going to talk about the other things related to the violence against the healthcare providers, I will conclude by saying that violence against doctors is an emerging epidemic amidst the COVID 19 pandemic, and it should be looked into seriously. There are deep rooted causes related to the health system, extremely negative impact of violence on performance and mental health of our doctors and healthcare workers. There are long-term implications for the health system, patient and doctors. And this situation needs immediate attention by short-term and long-term measures so that the situation can be taken care of. And lastly, I will just end by saying and sharing a statement. No physician, however conscientious or careful, can tell what day or hour he may not be the object of some undeserved attack, malicious accusation, blackmail, or suit for damages. With this, I would like to thank you all. Have a great day. Thank you.
Thank you, Dr. Rabina, and it was indeed a pleasure, as always, listen to you. And of course, Stress is one of the reasons which causes all these things to erupt. And it's good to have some senior doctors as well with us, with all this younger crowd, so they can also have their input and questions in the later on the part. So moving on, my next speaker is going to be from India, Agra, uh, Professor Narendra Modra. I don't know how many people know him. Uh, just get his CV out. I'm so sorry.
Greetings to everyone in
He's the
Pakistan
managing
in this
director of
wonderful
Global
congress which
Rainbow
you have
Healthcare
organized,
System in
the
Agra.
SOGP.
He's the
I've been asked
director
to talk to
of
you
Rainbow
on
IVF.
violence against
He's
doctors,
the
an
past
emerging epidemic amongst
president
the
for
COVID-19 pandemic.
ISAR, ISPAT, IFUMB, FOXY, AOGS, ICM. So he has almost more than 55 books and number of publications nationally and internationally. So unfortunately, he could not be here. So we have his recorded talk with us. So if it's possible, can you play the talk? Dr. Narendra's
I've
talk,
been
please.
asked to talk to you on violence against doctors, an emerging epidemic amongst the COVID-19 pandemic. In India, I'll be
You don't have
concentrating,
the
but it
volume,
is world over. So world over. See, look at this video in the news which has come after this person, Pakistan, in this wonderful congress which you have organized, the SOGP. I've been asked to talk to you on violence against doctors, an
वैसे मैं आपको
emerging
जब तक ये
epidemic
लगाते हैं ये
amongst
बता
the
दूं अभी
COVID-19
रिसेंटली
pandemic.
कोई कुछ दिन पहले
In India, I'll be
पीएमसी से
concentrating,
एक
but it is world over. So
केस
world
गया
over.
था उनके
See,
पास
look at this
फॉर
video in the
negligence and
news
what
which has
not
come
and they
after this
found out
person
that
died.
the
Look how
case was
all
fake
the attendants
and the
barged into the
persons who filed
ward
that
and
case
started beating
against
up the
the
doctors
doctor
and the
were
healthcare
fined
profession. So
20
this
lakh
should never be
rupees on the spot.
happening in this.
So we do
And
have
then
all
another
these kind
news
of laws
item here,
in there,
which we can see,
but the problem is that
that
we
violence
need to
against
know where
doctors
they
in
are.
COVID times is there, and how to do
But
it,
straight
how
from
to
the
prevent
start,
it, why it happens, when it happens. I thank my co-authors to talk to you on violence against doctors, an emerging epidemic amongst the COVID-19 pandemic. In India, I'll be concentrating, but it is world over. So world over. See, look at this video in the news which has come after this person died. Look how all the attendants barged into the ward and started beating up the doctors and the healthcare professions. So this should never be happening in this. And then another news item here, which we can see, that violence against doctors in COVID times is there, and how to do it, how to prevent it, why it happens, when it happens. I thank my co-authors, Dr. Niranjan Chauhan and Reena Wani, who shared the violence against doctors presentation and the COVID presentation Dr. Jaideep added for us. So we did in this times run into a lot of emergencies and even bigger hospitals where we took care. So we selflessly took care of patients, did not go home, did not eat feed, beat all the odds, did 14, 16, 20 hours duties together, did not see see our family for days because we were isolated there. We might carry the infection outside. And this still, when you look at the BBC published report on 3rd of April 2020, actual severe pandemic hit India in the mid-April, but even early, Indian doctors were spat at, they were spitting, they were throwing stones. They threw the junior doctors out of their houses where they were living. The shopkeepers did not give them, and that's when our Prime Minister addressed the nation and told that, and the Parliament, that doctors have to be looked after. Lakhs and lakhs of doctors were looked after, and they were declared as health warriors. The doctors, the paramedical staff were asked to work like soldiers, and that is where we were praised by the public, by some of the public, and other things happened. So COVID changed the whole scenario. The scenario was quite bad in the developing countries and is still quite bad in the developing countries as violence against doctors because of a lot of reasons. We'll just come to those. But in COVID, it was like fire. So the situation in the world, the COVID spread all over. People were dying all over the world. And today we have the Omicron and we have the Delta Coron and we have newer variants which might just come in and still be equally bad like the April 2020 outbreak. Hong Kong still is facing a complete lockdown and a very severe wave. The rest of the world, the cases are reducing and things are improving, but new variants would come. So we need to be prepared. Now, look at what Robert Owen said long back. He said, God and doctors are alike adored, but only when the patient is in danger, not before. And once the danger is over, both are acquitted. God is forgotten and the doctor is slighted. So that is what is the reality about God and doctors. And that led to violence against doctors, and that led to all the junior doctors in India come down to the roads with placards, Doctor ke achhe din, do not harm your lifesavers. We are a nation, respect your soldiers. Now, these are some of the statistics before the COVID times, which were done in a webinar very soon. And a study by the Indian Medical Association in 2018-19 showed, before the COVID, that 80% of the doctors in India were stressed in their profession. Fear of violence, fear of being sued, fear of the patients for violence, and they were hiring severe security in their premises. So that was what is happening. And then the violence against doctors cannot be tolerated. Lots and lots of newspaper articles, editorials, all that came out. And all the things, everyone worked on it. A lot of cartoons came out in the magazines and in the papers. You see many newses, doctors assaulted and beaten up in Ahmedabad hospital, junior doctors beaten up at JJ hospital, but then those who beat them up got arrested. Baby dies and the family beats up the doctor. Sion hospital, third attack in 1 week. These things kept on happening in the public sector hospitals and more also in the private sector hospital. Then in 2003, we saw a SARS outbreak. So worse disease, could not be treated. And it was attacking all the systems. And again, people were dying. And then the violence increased. Then, of course, came COVID-19. 2019, November, the first COVID case, and India faced a crisis. The world faced a crisis. And all the leaders came out against this, and there were bodies all over, the people dying, and we did not know what the cure was. We did not know how to do it, and then led to an increase in violence against doctors, an increase in crowds, public outrage against the medical facilities. So when we look at what happened was, COVID-19 was an explosive fuel raising the fire, and this fire got activated because of people dying. So despite of many reactionary measures, enhanced security to the doctors, workplace, medical negligence laws, Indian doctors teetering the pandemic, detrimental growth, all that, the society just reacted very badly, and the media fueled this. So the pandemic, the COVID, became probably the #1 cause of death. And that led to strict social distancing measures, and the doctors got scared. So what we need, the challenge we faced was that patient concern. We need to save the patient, whatever. Practice management, how to manage our practice with the non-COVID and COVID patients and segregate them, and medical staff getting infected and medical staff being cared for. So that was the biggest challenge. And then staying for hours and hours and days in this uniform, sweating inside and not even being able to change, taking the disease back home. That was. So it was a fiery recipe for disaster. And who was blamed? The healthcare worker. So that led to such a outcry that in the last 2 years, so many doctors had refused to send their children, these lovely girls who are giving the exam for entrance exam, to make them doctors. And a majority of doctors are now unwilling to motivate just because of this. Every day there was a breaking news of attack. Local doctors attacked. These 2 girls just went for a survey into a colony and they were beaten up. And this video was the most viral video in India of these 2 girls. See how they were pelted by stones. And, you know, it was not only COVID. That time, India was having a law, or what we call as for citizen amendment law. And that a lot of people had a bad, negative value of that law. So was spreading negative rumors about that law, and the pandemic came. So that probably that also made the whole things worse. So doctors being beaten up, doctors being not able to go and do surveys or do treatments. And this video went very, very viral. So, but the BBC, task force, Dr. Ananda, Government of India, nothing, even the CA law, controversial citizenship law, anything can justify the attack against a medical team. This did happen, and the anger did spill. So this was condemned. Then the Government of India took some steps. They gave Corona Warriors Awards. They put petals over the hospitals from helicopters on the hospitals which are dealing with COVID patients, and they flowered all of us. And so government agencies did work in tandem with the public and tried to boost up the image of the medical. And our Prime Minister himself in his speech in the Parliament said, these are the health warriors and these need to be respected. So these cases could have been handled better or not better. How we could have prevented such an attack of a doctor lying like a patient all beaten up is going to be a debate. The private sector was equally affected, especially those private hospitals were allowed to do COVID duties. Small private hospitals were all closed down in the first wave. In the second wave, we all did work in the not COVID. What caused this image is some poor image, which is highlighted by the media, because the health budget is poor. So the public hospital care is not as they want as a 5-star. There is a small and medium hospitals which were at risk. The faith in the judicial process is not there. The cases take a long time. The mob mentality, one of them puts a fire and the whole mob reacts. Health literacy is low. Nobody saves money for health. Whenever a worker you ask, they save money for a daughter's wedding, son's wedding, make a house, everyday food, but there is no health budget because everyone feels that they will not get sick and nobody takes insurance. Lack of security, lack of insurance, poor communication, all that led to all this. In our specialty, OBGYN, pregnancy was a stress, infertility was a stress, ART services stopped, pregnant patients were dying. So that put additional stress, young, pregnant, COVID-affected patients, and more violence erupted. So what we did was, we put a counselor. So we put extra counselor and we did a teleconsultation with all pregnant women who were registered with us and to their families. And we ourselves would visit them in the hospital, in the ICU, cheering them up. You know, I will tell you that there were times because we got COVID in first week of April. So I was immune and Jerry was immune. So we both used to visit the ICU every day, take some sweets for the people who are recovering, who are suffering. We would go as Santa Claus. We would go dressed up as gods and try to boost up. So that image of, so you have to have a tender loving care also. So that, and of course, charges do not overcharge. The government had put a cap in India on treatment caps, and that was followed. You know, there were a lot of myths circulated when the vaccine came. And so vaccine hesitancy increased. And that was another challenge for us. So whenever we would go to vaccinate, again get beaten up. Because people would say, it'll make you impotent, it'll make you infertile, and all that bullshit. But we got all our staff vaccinated, all our healthcare persons vaccinated, very, very essential. We proudly say this hospital staff is fully vaccinated. And that's a badge which my staff carries on the chest very proudly. Well, the first medical law was done in the state of Maharashtra before the COVID times. And this said that if a medical service person is abused or while violence is against him, then they will go to the first class judicial magistrate and the punishment would be done to them. If the offender has to be punished, and that is a state government official gadget. During the COVID, the national central law came in for prevention of violence. We were all fighting for the national law, and it became a cognizable offense with stringent punishment. So what should we as doctors do? Do not overreach. Do not take proper consents. record documentation, proper communication, be very alert, restrict the entry of attendants, standard operating procedure, follow that, and take an insurance. And then we have to pressurize our governments, all of us, to make it a criminal offense to attack a doctor. Just like to attack a Indian administrative service or a civil service officer is a criminal offense, same has to be made for the doctor. That's what it. And then we made manuals and we circulated to the police so that the police is well aware of what the latest law is and what are the doctor's problems are. 2018, under the presidency of Dr. Jaideep Malhotra and our federation, the Federation of OBGYN Societies of India, 34,000 members, 256 cities, made a violence against doctor cell. And in this cell, we appointed a doctor in all the branches where anyone who is attacked would address their problem in this algorithm. The problem will be sent to the police, to the lawyer, to the central office, and proper action or help will be given to that doctor who's. So immediately when a mob attacks, all the doctors of that city gather there and fight that mob or try to explain and then call the police, call the lawyer, and do a proper legal. So this is how we are tackling violence against doctors, non-COVID, and during COVID times, this has become active. So ladies and gentlemen, we have to stop violence against doctors. That is what we have to do, build up our image, build up our truthfulness, build up our honesty, and build up our not overcharging and trying to. So to conclude, COVID will stay with us. If COVID doesn't stay with us, some other new disease will come, which will be maybe even worse. So pandemics are going to come because the human mankind has tempered with the environment so much that we're going to get newer and newer diseases. But of course, we will find cures and vaccines for all of them. So good practice guideline following at all possible levels, awareness program for people, insurance for healthcare workers, for hospitals, for hospitalization. The world is not going to be the same place as ever to live at. So let's live it with all the precautions. And we thank the Government of India and the Prime Minister of India for flowering us or recognizing healthcare workers as healthcare warriors. And this is what they did to us, which boosted us to fight this pandemic. We are going to win. We will end this pandemic very soon. And we will be ready to face any future pandemics which might be coming. Thank you for inviting me here. I'm there for any questions which you might have live or you might address to the chairperson right now and can be sent to me. So thank you all our friends in Pakistan, the Society of OBGYN Pakistan, SOGP. Congratulations for organizing this conference and thank you very much for inviting me here to be a part of it, to share some of my views on violence against doctors, especially in COVID times. Thank you. Greetings to everyone in Pakistan in this wonderful Congress which you have organized, the SOGP. I've been asked to talk to you on.
Loop mein chal gayi. Okay, thank you, Dr. Narendra. And indeed, COVID is and was a difficult time which everybody has gone through, and we have seen the problems it has come with that. And let's hope we'll get over with it and we can tell the stories to our children what happened to us during this bad time. So moving on to our last speaker, another past president of, immediate actually past president of SAFOG, Professor Fardausi Begum from Bangladesh. She is the president of Ops and Gynecology of Bangladesh currently, and she's a member technical subcommittee in WHO, and she's a member of FIGO committee on childbirth and PPH. She's going to be joining us online, and yes, I can see her. Madam, can you hear us?
Yes, of course. Assalamu alaikum.
Then over to you. She's going to talk about the way forward from now, how to go about it. Over to you, madam, now.
Assalamu alaikum and a very good afternoon to all of you. Basically, I'm really happy as I have been invited as a speaker in a very prestigious conference of Society of Obstetricians and Gynecologists of Pakistan, and my salam to President and Secretary General Fuji has been, all the executive members and all past presidents of um, SOGP and SAFOG as well. Because we know that Professor Rashid Latif Khan is the dreamer of this, and the SAFOG is running well, keeping an eye on the interest of this region. So let me try if I can share my slides. Oh my goodness. I think it will not be possible because this is StreamYard. Mhm. No, I cannot, but I have my slides, so I'll be going on through this. My topic of presentation today is the prevention and way forward to violence against healthcare professionals. As we know, the situation, especially from the presentation of Professor Rubina and Dr. Narendra Malhotra, and also words from Yusuf and Dr. Rohana, that this is a grave condition, and sometimes it crosses the limits, so that we really suffer. It's not only the suffering of the patient, healthcare professionals, ultimately the patients suffer. So violence against our healthcare affects us all. It impacts our families and communities as well. And as we have gone through that, the violence affects all kind of service providers, but especially the nurses.
Dr. Firdausi, can you share your screen so we can see the slide? We can't.
Unfortunately, I cannot do it because of this stream. I'm not very.
So that's okay then. We'll continue with this like
Yeah,
this.
I have my slides, but I cannot. I have tried through the stream, but it shows something which I cannot tackle basically. Yeah, it shows the screen, share screen. Mm,
You can tell.
Well, ma'am, you can share your screen. The icon is present on the desktop itself. You could just see down.
yeah,
You will
but
find it.
it shows the share screen, but I
Yeah,
see only myself. I don't see the slides.
you just have to press share after that.
Yeah, share. It
And
doesn't
I
come.
hope you're sharing your entire screen.
Let's con-
Okay, that's me only. I don't
Okay.
see the slides here. No option
Madam,
for
let's
my.
continue with like this. It's fine. I think we're good.
Yeah. So let me uh, share talk from my slides. So one of the key is the bringing together the key stakeholders, experts, and patient advocates to advise on how to reduce and prevent workplace violence for healthcare professionals. Because as we have seen that this is unique in different countries. There are many things which are common, but there is something specific in different countries. So we need to tackle this internationally and nationally as well. Workplace violence is usually classified into four categories. One is physical violence. We know that this punching, we have just see the slapping of a doctor, and other sort of physical violence, then verbal violence, then sometimes racial violence, and sometimes it may went up to sexual violence as well, including embarrassments and harassments. The consequences of violence are physical, psychological, so including post-traumatic and stress disorder. It can go to a severe form as well. Then it can be emotional, with different stress level of stress, anger, sadness. Then workplace, I think the environment disturbance, lack of quitting the job, changing employers, and all this. Patient dissatisfaction affecting quality of the care and social or personal or negative attitudes, even in the family, and also financial uh, consequences. This is the there are some recommendations, as you cannot see. I am reading it out. These are there are some recommendations which have been taken by the Canadian government to prevent violence against professionals. These are uh, violence policies in the hospital, like quality improvement plans, then increased support for patients with non-aggressive or violent behaviors, patient and family staff input, uh, which causes triggers, behaviors, and some interventions, and creating reporting system for work uh, workplace violence. There are different studies done. There are big ones as well. Mostly these are qualitative rather than quantitative, and their recommendation is the implementation of organizational and managerial interventions, including education programs, which is most effective to improve control of violence against staff in healthcare centers. And some studies also have shown to focus on organizational measures on patients like employees and others. Um, Going through the literature and from my personal experience of long 35 years, we can classify the interventions for prevention of violence against professionals can be international, like ISWIFIGO, like other professional bodies. So they have their own policies, and time to time they should come forward. Especially we have seen the thing which has been occurring during COVID-19, the pandemic. So time to time policies are set to be there, national. There must be national policies, including the government. And as I understand, that none of the countries, I'm not sure about Pakistan, but as far as I know, there is no solid or pronounced rule to protect professionals, um, because always the public interest gets the priority, not the professionals. It's not only for the doctors only, for the other professionals as well. So we should come forward together with strongly as a group, all the doctors, nurses, and healthcare professionals, to uh, have pressure on the government, not only pressure, to make them understand that if we do not feel safe, how can we provide services? Then professionals, yeah, this is very important. We must be, because there are many things happen due to our sometimes our carelessness or lack of knowledge and skill, and sometimes our unprofessional behavior. So professionalism is very important. All the time we should maintain our dignity. We must be renewing updating our skills and knowledge and attitude always. And what we see in the medical curriculum, even in nursing curriculum, the attitudinal part, the communication part lacks, which needs strengthening. Then the patient and client. I think the hospital and clinics should always have, even nationally, enough information material for the patient and clients, that they should not expect something which is not real. Sometimes they have their expectation, unreal expectation. So they need to come down to the ground, that this is the way the things are going on. We were talking of COVID-19 situation. uh, due to the lack of oxygen, which is not the fault of the doctors or the nurses, they were insulted. So these things has to be understood, and administration should come forward. And family has a role to have the attitude, growing a positive attitude to everything, and the patients, because there are many persons who are typically uh, angry and irrational behavior. So that's the role of the family as well. Community has a role to play, greater role to play, because we have seen this in the COVID-19 period. And as Dr. Narendra was telling, the support from the community, from the government to encourage and giving proper dignity to the healthcare professionals helped it a lot. The lawmakers, whenever lawmaking comes, the place of doctors goes down. The value of public comes forward, but there should be a balance. In Bangladesh, the law which is on the process, it it is stuck somewhere because of the imbalance between these two aspects. The law enforcement authorities, they sometimes behave so rude. During the pandemic, we have seen that there was a lockdown, and a doctor coming out from from the hospital to home, she doesn't have the emergency pass, so though she was wearing a apron, her car has a sticker of the hospital. Still, she was being harassed by a senior police officer, and there was a magistrate as well. So this is very irrational. The people should at least have some honor to the persons who work for day and night, and that there is the role of us, including we should come to the media and the journalists to be on our side. Many of the times, somehow we do not have very good relationship with them, but we have to do that. We should be sitting with them time to time so that we can clarify our situations, and they can be a great friend of us, especially during the time of crisis, and to make public opinion. So these were my presentations. I again thank everyone for giving me this opportunity, and being with you in this very important program.